Nervous system regulation through listening, the science and applications. How do they work? Auditory processing. Auditory processing is the receipt, integration, and interpretation of acoustic energy and is closely linked to other sensory, central, and autonomic nervous systems. Accurate and discriminatory perception of sound is dependent on the function of the middle ear muscles, which tighten the tympanic membrane or eardrum to support the perception and attenuation of certain frequencies. The middle ear transfer function is connected to a network of cranial nerves that contribute to the integration of sound with other sensory inputs in the brainstem, leading to cognitive, behavioral, and physiological responses. The auditory processing system is a portal that fundamentally changes the way we experience and respond to the world. Our sensory system builds the foundation for how we experience the world. The SSP is uniquely designed to improve auditory processing and reduce sound sensitivities by engaging middle ear muscles to better perceive the sounds of safe human communication. These safety cues influence the central and autonomic nervous systems through the auditory portal, leading to improved regulation and sensory processing across systems. Our sensory systems build the foundation of how we experience the world and inform higher level functions like movement and cognition. Research has shown that inaccurate perception of auditory cues can influence bodily perception, movement, and emotions, and further impact motor behavior. The ILS uniquely combines auditory processing with several other sensory systems, vestibular, proprioceptive, visual, etc., to enhance functional skills from a foundation of accurate, discriminatory, and well-organized sensory information. Rest and Restore Protocol, RRP, integrates several acoustic parameters, including frequency, tempo, and musical composition, to homeostasis and recovery. Entrainment is a key component of RRP's impact. Entrainment is a biological phenomenon in which adjacent rhythms gradually fall into synchrony. The ebb and flow of the rhythms embedded in RRP facilitate the process of entrainment by bringing natural and physiological rhythms into homeostatic synchronization. When we're stressed or ill, these rhythms are expressed with a lower amplitude and may drift into a more chaotic, random pattern. In contrast, when our bodies are in states supporting homeostasis, the endogenous rhythms of the body appear to be expressed with higher amplitude and more structured rhythmicity. The vagus nerve serves as a key role in communicating information between the brain and body. The vagus nerve is the longest nerve in the human body and is often described as the wandering nerve due to its extensive reach across bodily systems. The vagus nerve serves a key role in communicating information between the brain and body with approximately 80% afferent fibers, communicating sensory information to the brain. Because of this communication superhighway, stimulating the vagus nerve could alter autonomic state and physiological functioning. There is a strong body of evidence behind the ability of the vagus nerve stimulation to improve clinical outcomes for seizures and mental health, among other conditions. Methods include invasive devices surgically embedded and non-invasive options such as VNS, transcutaneous electrical stimulation to areas of the body where the vagus nerve is most superficial, like the neck or ear. Emerging evidence suggests that non-invasive methods can reduce sympathetic activity, treat cluster headaches and migraines, reduce dizziness, and improve gastrointestinal function. More specifically, the VNS through the auricular branch can improve functional pain outcomes, depression symptoms, and acutely increase heart rate variability, a sign of health and resilience, HRV. The vagus nerve can also be reached through indirect paths. The SSP functions as a non-invasive acoustic vagal nerve stimulator, offering a low-risk, accessible alternative to electrical stimulation devices. By sending cues of safety through the middle frequencies, the SSP engages the social engagement system, an integrated system of cranial nerves and structures of the face and head that enables social behaviors like facial expression, head turning, speaking, and listening, alongside coordinating essential functions like swallowing, chewing, nursing as in infants, and regulation of the heart and lungs. This system has a biodirectional relationship with the cortex and the brainstem, where sensory information converges and is processed from the internal and external environment. Through the lens of polyvagal theory, Porges 1995, the social engagement system evolved to enhance the ability to communicate, collaborate, and build trusting relationships with others from a neurological foundation of safety. This indirect activation of the vagus nerve through the social engagement system can improve autonomic function and well-being. The calming effects of the integrated learning system similarly activate the healing qualities of the vagus nerve, accessed through the auricular branch, which emerges onto the anterior surface of the eardrum and the ear canal. Many individuals with sensory learning and developmental differences experience stress in home and school environments, leading to sympathetic overactivation. As the parasympathetic nervous system becomes more dominant during ILS listening, the sympathetic nervous system dampens, allowing the individual to be happier, alert, attentive, and available for therapeutic intervention and learning. Regular use of RRP through its entrainment of physiological rhythms may help increase vagal tone, a marker of autonomic flexibility and resilience. Higher vagal tone is associated with better emotional regulation, improved stress recovery, and enhanced ability to adapt to life's demands, fostering a more resilient nervous system. It is my hope to the polyvagal theory. Polyvagal theory posits that the conditions surrounding human evolution led to a unique mammalian adaptations that enhanced our ability to socially engage with others. These include the emergence of two distinct vagal systems, the ventral vagal, originating in the nucleus ambiguous, and the dorsal vagal, originating in the dorsal motor nucleus complexes that facilitate our neurophysiological response to environmental demands. How we respond to stress mirrors our evolutionary and embryological development and is guided by the subconscious detection of cues of safety, danger, or life threat in the internal and external environment called neuroception. When we feel safe, the ventral vagal complex enables us to relax our defenses to support communication, collaboration, and restorative homeostatic functions. When we feel in danger, the sympathetic nervous system is our first line of defense, helping us mobilize to fight or flight the stressor. When we are unsuccessful or our internal resources are expended, the dorsal vagal complex of the parasympathetic nervous system immobilizes and shuts the body down. While this system can have restorative qualities over time, in response to chronic illness, stress, or difficult life events, we may also become stuck in a state of defense, limiting our ability to return to safe and healing human connection. Polyvagal theory provides a new lens for understanding how listening is linked to autonomic state. Porges and Lewis explain how mammals developed a unique perceptual advantage in listening, made possible by middle ear structures that improve the perception of human voice against background sounds. Because the neural regulation of the middle ear muscles and heart rate are linked through the social engagement system, prosthetic vocal sounds, and similarly middle frequency music, can help calm physiological state and prompt social behaviors. This work is informed by Borg and Counter, who describe how the function and pathways of the middle ear muscles support unique mammalian abilities in sound perception and attenuation. The regulating qualities of prosthetic human voice were similarly demonstrated in work by Kolizek and colleagues, who found that strong middle frequencies reduced high frequencies and fluctuations in intonation, predicted decreases in infant distress and improvement in infants' autonomic regulation. Non-vocal music has been shown to have similar effects, including promoting emotional bonding and significantly reducing the severity of PTSD in mothers of premature infants in the NICU. The SSP is a practical application of polyvagal theory that prioritizes the modulation, prosody of middle frequencies in the range of human voice. Gradually, in training and exercising the associated neural network to better perceive human speech and especially special vocal cues of safety, this improved neuroceptive capacity can help reduce auditory hypersensitivity, increase social behaviors, and enhance autonomic regulation, especially when paired with co-regulation and regulating activities. The ILS centers the importance of connection and relationship in facilitating change. The movement activities that pair with ILS listening are designed to incorporate a peer or caregiver, centering the guiding principle of join with joy, knowing that play, in the context of a meaningful relationship, supports holistic neural organization and integration, and increases interest, motivation, and engagement. The dynamically modulated tempo patterns of RRP are gradually tuned to entrain physiological rhythms, engaging both the dorsal and ventral vagal complexes. By synchronizing sound with the body's natural rhythms, example breathing, body, and blood pressure, RRP enhances parasympathetic activation, helping users move into a more restful state in which the brain and body form a more coherent state of co-regulation. RRP promotes a sense of safety, relaxation, and connection without recruiting the motor behaviors related to social engagement. For users who may be stuck in a state of dorsal vagal activation, characterized by shutdown or immobilization, the subtle rhythmic entrainment of RRP can help guide the rhythm into immobilization without fear, designed to gently re-engage the body's endogenous visceral rhythms, restoring energy and alleviating feelings of dissociation and overwhelm. Neuroplasticity. As we have learned through the culminating literature on the brain and nervous system, there are many neural capacities evoked in music-based interventions, including the ability of the brain to change in response to stimulation known as neuroplasticity. The ILS is based on this principle and provides gentle and specific stimulation to activate the neural pathways used in the processing of sensory information. Neural connections in these pathways are strengthened and new connections are established through repeated sessions of multisensory input, allowing the nervous system to adapt and find safety more quickly and easily. Just as with physical activities, specific, simultaneous, and repeated multisensory stimulation gradually trains the brain and body to process and respond to multisensory input more effectively, through better organization, leading to improved function in the world. The ILS programs are 20 to 60 hours each and informed by the qualities of specificity, repetition, intensity, time, and salience, essential to neuroplastic change. The SSP gradually and dynamically retrains the auditory processing system to better perceive and attend to calming middle frequencies through dynamic progressive filtration. While this process is designed to have immediate effects on autonomic state, neuroplastic changes can also occur as the individual integrates their memories and visceral feelings with top-down processes. Each SSP program includes 5 hours of music and 3 pathways with varying levels of intensity, which can be used to customize delivery on an ongoing basis for lasting change. Similarly, the RRP is designed to guide the listener through a unique sound journey, enabling their brain and body to passively shift into a healing nervous system state. As the acoustic parameters become more complex across the 5 hours, RRP cultivates reattunement and easier access to new neural pathways. Listeners can return to supportive segments at any time to remind their system how to find ease and rest in homeostasis. Therapeutic relationship and process. Further research on music-based interventions highlight the importance of therapeutic relationships and the process delivery behind the music itself. Ribeiro and others in 2018 emphasized the importance of the therapeutic process of delivery on outcomes, including thoughtful selection of music, considering preference, quiet reflection, and verbal processing, leading to improvements in autonomic regulation, lower anxiety and depression in mothers of preterm infants. Pearl and colleagues in 2013 similarly describe the role of the skilled therapist in promoting change through music. Baker and others in 2018 further attribute significant reductions in symptoms of PTSD to the ongoing presence of a skilled therapist, compared to groups with little involvement or absence of a therapist. Citing polyvagal theory and the importance of the felt safety, Rutstem and others in 2023 describe a trauma-focused group music program that centered processing and expression. Group members reported increased interpersonal safety and connection with feelings and bodily sensations, in addition to an experience of expansion, relaxation, and new energy. These reports were in parallel with significant improvements in PTSD dissociation, anxiety, and depression. Unite Listening Therapies center the therapeutic relationship supported by a thorough and ongoing education process that requires certification for delivery. This ensures that skilled providers are equipped with essential knowledge and training about how music affects the brain and body, alongside development of evidence-based practices for integrating listening therapies across disciplines, modalities, populations, and practice settings.